very excited and honored to be able to bring to you Brenda Edison, who is the Associate Director of Clinical Affairs at NeoStrata company. So if there is something that Barbara doesn't know about, I'm sure it's not worth knowing. We're super excited and honored to have you here. I believe we need to say good morning to you as it's good afternoon here. So good morning to you, Barbara, and I leave the floor to you when you're ready.
Okay, thanks very much. I'm really excited to be here. I'm Brenda Edison from NeoStrata, and as she introduced, I work in our clinical affairs group, working with all of our clinical studies and technologies, and I'm really excited to be here this afternoon with all of you. So I'm going to talk a little bit about our NeoStrata ingredient technologies and how they apply for acne-prone and oily skin. So just to go over a little bit of what you'll see today, we'll do a very quick overview of acne. I'm sure everyone here is very well versed in that, but just to get us all together on the same topic, and then go over some of the NeoStrata ingredients that we have that do address acne and acne-prone skin. And a lot of nice data and clinical support for those ingredient technologies. So I'm excited to share all of that with you this afternoon. And then also we'll touch upon NeoStrata solutions, so some of our products that include these technologies that will help to address things like oily and acne-prone skin and specific segments that we have to address that, or normal to oily skin conditions that have maybe occasional breakouts, and then also adjunctive therapy with some of our products that you can use in addition to your topicals or prescriptions. And then a little bit around our professional use AHA or alpha hydroxy acid and retinol peels. And those are for professional administration only. And so we'll see some benefits from those as well. So again, I'm sure there isn't anyone here that doesn't know what acne is and probably, quite frankly, hasn't experienced it themselves. So of course, it is a chronic inflammation in the sebaceous gland and hair follicle. And we know it's characterized by the formation of comedones, papules, and pustules, and then less frequently, but still problematic, cysts or nodules that can then result in acne scarring. A little about the epidemiology of acne, and I actually always really love going through this slide because it's such a prevalent condition. And so, of course, one of the most common skin condition, it's consistently represented in the top 3 most prevalent skin conditions in the general population. And, sometimes we forget it does affect patients or clients of all ages. And so it affects 85% of young adults, for sure. We know that from 12 to 24 years, and we've all probably personally experienced it or at least seen it in our friends. But it does continue into the next decades. And so even in your 20s, 64% of the population are still affected by acne. And as you reach your 30s, still 43% are afflicted with acne. And even into your 40s, almost 10% of the population is still kind of battling these acne breakouts. And so, it does reach really across the population and is a problem for decades and decades for people. It does have an 80% heritability rate. So if your first degree relatives had acne, there's a high chance that you will also experience it. And then we know that it has profound physical and emotional ramifications. So it's not just treating the condition, it also, treating the condition can benefit quality of life or self-esteem and mood. And we know that acne also can increase the risk of anxiety, depression, and suicidal ideation. This is a little bit of a repeat of the last slide, but I really like the graphic here. It goes through and shows along the bottom through the years, the chronology as you're aging, and where acne kind of hits, right? So you definitely get this peak, like we just said, afflicting a majority of the population in their teens and maybe early 20s. But there's some additional acne breakouts, and people experience it through their 20s, 30s, and 40s. And then this chart actually adds in green rosacea as a condition that comes up perhaps later in life and peaks around your 40s and 50s. And so I think this is just kind of a nice visual of how pervasive acne can be. So treatment approaches. There are many. A few are listed here, and the most common, I would say. So you have your keratolytic agents, right? Those help break down the impacted material in the follicle, and those are ingredients like salicylic acid or resorcinol. You also have exfoliants, which help normalize cell turnover, which clears the clogged pores. And so those are your AHAs, your alpha hydroxy acids like glycolic and mandelic acids, or your polyhydroxy acids like gluconolactone, and acetylglucosamine, which is a non-acid amino sugar. And we'll get into a lot of those ingredients today in the talk and as they relate to NeoStrata products. And then, of course, you have your topical antibacterials that have benefits to acne, so your benzoyl oil peroxide, various other ingredients, prescription, non-prescription, and then systemic antibiotics, of course, you know, in the armamentarium to treat acne. So this is a history slide on NeoStrata's ingredient approach to acne and oily skin, how it began. So a little history for you for where our journey has come from and where we are now. Back in the early 1970s, we had a pivotal discovery by our founders of NeoStrata, discovering the alpha hydroxy acids and their benefits for skin. And so, you know, starting with benefits for disease conditions such as ichthyosis, but moving into the realization that this has real benefits in exfoliation on the skin, benefits for skin health and benefits to acne, and then of course the well-known benefits for anti-aging. And then the company was introduced in the NeoStrata brand, and then we moved to our second generation of hydroxy acids, which are our polyhydroxy acids and includes gluconolactone. And then more recently in the 2000s, moved to non-acid technology and introducing those benefits, and specifically those benefits in acne as well, for a non-acid technology. And so we'll use those ingredients that I have talked about and listed here on the graphic on the right to go through some product approaches via home care products and how those can help in this condition of acne, and then professional peels as well. So how do AHAs work? Well, we know that they unclog pores, and so they do this by reducing the corneocyte cohesion at the lower levels of the stratum corneum. And so this normalizes keratinization and enables a specific transient exfoliation response. So it does work a little differently than the keratolytics, like salicylic acid. It's not just sloughing the skin. It is really normalizing this keratinization process, and so it reduces the corneocyte buildup in the pores and allows them to stay exfoliated and cleared. And we'll see some benefits in before and after photos for that. It also can help reduce pigmentation, or more specifically to acne, post-inflammatory hyperpigmentation. So we know that AHAs can reduce pigmentation irregularities via exfoliation, and they also diminish via melanin clumping in the cells. And then, of course, they do have anti-aging benefits and skin health benefits to continue in their benefit to skin. So the first AHA that we're going to talk about is mandelic acid. It is an AHA molecule derived from almonds. It's a more soluble form of an AHA, and so it really makes it ideal for patients with acne or oily skin, just because it can penetrate that oily environment. It's lipophilic, that's where it loves to sit, in these oily environments. And like other AHAs, it's an effective exfoliant and does have some oil controlling properties. And we actually have some new science around this molecule that we just presented at this year's American Academy of Dermatology. And so while that live meeting got postponed, it is happening right now in a virtual environment. And so this poster goes through mandelic acid, a lipophilic AHA that reduces lipid production, enhances exfoliation, and then provides clinical and patient perceivable benefits to oily and photo damaged skin. So both, the acne component and the photo damage component. So this is a very busy slide, but what I really want you to look at here is the graph on the left. And so this is showing inhibition of lipid production with mandelic acid using in vitro cultured sebocytes. So mandelic was added to this cultured sebocytes in vitro. There was an untreated cell, so that's the first one you see here, and obviously there's no inhibition in the lipid production. For that, we have a positive control showing 100% inhibition, and then here we have mandelic showing a 41% inhibition in the production of these neutral lipids, and so really showing a benefit to oil control and oil production. And then on the right here, we know AHAs are good exfoliants, and mandelic is no exception. And so it's really just showing here that there's a mandelic acid cleanser and a mandelic acid cream, and showing over the course of a week the enhanced exfoliation that you can see with the blue line over an untreated area. And again, busy slide, but this goes through all the details from our poster, but the results here on the right are showing a 4% mandelic acid containing product and its benefits in clinical grading. We had a clinical study conducted on this, and we had clinical graders grade across the course of 8 weeks for presence of oil, so a tactile assessment of that, and then appearance of shine as well. And so this clinical grading showed a statistically significant improvement in oiliness and shine at all the weeks, as early as week 1 and 2, and continuing through week 8, with a 73% reduction in oiliness and a 67% reduction in shine, which is some really nice benefits to the appearance of these conditions. And so we also were looking at the benefits to photo damage. So of course we know AHAs have that benefit as well. And so I'm sharing this just as an aside here, that there were some nice benefits to fine lines and things like clarity, brightness, and pore size as they relate to, oily or acne prone skin. And then here are some very nice before and after photos. So again, not concentrating so much on the condition of acne in this study, but on the oiliness component. And so you can see before at week 0, and then these are after 8 weeks of use. Obviously the shine is apparent in the before photo, where you're really seeing that oiliness reflect in the light. And then you can see the reduced shine or a matte appearance, and then also improved texture and less visible pores, or just an overall nice benefit to better skin clarity, along with the reduced shine in the after photos. And so just as a quick summary of mandelic acid, so we looked through reducing lipid production, and so we know mandelic acid is ideally suited for oily skin due to its lipophilic AHA structure, the sebaceous neutral lipid production inhibition that we went through that data, and its ability to enhance exfoliation. And then in the clinical study, we saw that these skin benefits were confirmed with reduced oiliness, shine, and then of course anti-aging effects as well. So still staying on mandelic acid, this is our oil control gel, and we did a quick assessment using SEBA tape, which is an analysis of sebum production. So if you're not familiar, it is a white tape that you put on the skin, and it has capillary action to really soak up the oil in the skin as it's producing it, and so it shows up as transparent spots, and so you can measure how much oil is really coming off the skin and do a comparison. And so here we did a comparison of treated with our oil control solution, and this is a 4% mandelic acid and 4% gluconolactone gel. And we compared that to untreated and saw after just one application, there was an 18% reduction in oiliness. And so a very nice result demonstrating the benefits of inhibiting this oil production in just in a different way as we had seen with this in vitro sebasite data. So a nice collection of data on mandelic acids and its ability to affect this acne environment. So I'm going to move next to N-acetylglucosamine. This is another ingredient that we have to benefit acne. And so this is a non-acid technology. So we talked about AHAs and specifically mandelic acid. And this is our non-acid amino sugar, which has some nice benefits to anti-aging, but to acne as well. And I'll share that information today. So what is N-acetylglucosamine? It is a natural component of human skin in the glycosaminoglycans, or the GAGs, in the glycolipids and in the membrane glycoproteins in skin. It's actually a building block of hyaluronic acid, one of the GAGs in skin. And so we know hyaluronic acid binds water and that it diminishes with age. And so it increases with the use of AHAs or retinoids, and also with N-acetylglucosamine as a building block, you can see some nice benefits to skin health and really building the matrix, the skin matrix. So some of the benefits it has for oily and acne-prone skin specifically is reducing the appearance of acne and reducing oiliness, and we'll go through some data on that, as well as improving clarity. And it has this nice benefit of being less drying and stinging compared to a 10% benzoyl peroxide. And so we'll share that data today as well. And so some additional benefits that it has relating to acne is this exfoliation and benefits to cell turnover, again, to keep the pores clear, benefits to clarity, and then, of course, some smoothing benefits from an anti-aging standpoint. So we'll go through the effects of topical N-acetylglucosamine on acne-prone skin, and this is a clinical study that we conducted and published, again, in a poster a few years ago at the American Academy of Dermatology. It was a double-blind, positive controlled IRB study, so had ethics review. The population was males and females, 13 to 29 years of age with mild to moderate acne. And so we did an 8% N-acetylglucosamine gel on 35 subjects, and then we compared it to a 10% topical benzoyl peroxide gel on 18 subjects as a control group. And both were applied twice a day to the entire face for 8 weeks. And we looked at some clinical grading, self-assessment, and digital photography. And so here are the inflammatory acne lesion counts. And so in the darker blue on the bottom is the N-acetylglucosamine, and then the top lighter blue line is the benzoyl peroxide cream. And so it's showing you across 8 weeks, you can see benefits, significant benefits from baseline for the N-acetylglucosamine gel as early as 1 week. It continues to improve at 2 weeks. And then interestingly, there's a 32% improvement in these inflammatory lesions at 2 weeks for the N-acetylglucosamine group versus an 18% improvement in using benzoyl peroxide. So both improving, but some advantages in the early time points for N-acetylglucosamine. And then as you get to 4 weeks, of course, benzoyl peroxide catches up and is doing as well as, and actually starts to outperform at that point, this cosmetic topical N-acetylglucosamine. But it is a gentle exfoliant and does help reduce acne and is ideal for adjunctive care to some of these other topicals. And so this is a nice example of a before and after photo. So again, just using 8% N-acetylglucosamine to improve this acne-prone skin. So you'll see the forehead on the left, that's baseline, and then in the middle after 4 weeks, obviously a reduced appearance in acne. And then at week 8, you can see some really nice clearing of the skin. Here's another example. And so this again goes through the before on the left, and then you can see the benefits to the acne and really improving texture and clarity and some of the post-inflammatory hyperpigmentation as well. So this is some self-assessment showing the less drying and less stinging nature of the N-acetylglucosamine compared to benzoyl peroxide. So again, the dark lines are the N-acetylglucosamine gel, and the lighter columns are benzoyl peroxide cream. On the left goes through time for self-assessment of was not drying, and so you see the N-acetylglucosamine gel was considered less drying. It was not drying compared to benzoyl peroxide. And then on the right is stinging and burning, and so actually some significant differences in less stinging or burning than a benzoyl peroxide cream, just showing the benefits to its tolerability. And this is a different way to show it. So we have, irritation parameters on the left, clinically graded or self-reported, and then the weeks across the top. And anywhere that you're seeing the little word NAG is where there was significantly better tolerability for the N-acetylglucosamine cream compared to the benzoyl peroxide cream. So across a lot of different irritation parameters and throughout the course of the 8-week study, showing better tolerability. So this non-acid anti-aging and acne technology is suitable for use for patients at home, and does have nice benefits to acne-prone skin, and we saw that via clinical grading, and also benefits to skin smoothness, which also can eventually help minimize the texture sometimes that you get after acne blemishes, and then continued improvements for these conditions, as well as really nice tolerability profile for N-acetylglucosamine in acne. And so these two ingredients, mandelic acid and neoglucosamine, are included in our NeoStrata Refine segment. And so this segment of products is really focused on oily and acne-prone skin types. It has the benefits that we just went through to these, so some nice benefits to reducing lipid production or oils, and then benefits to clearer skin, exfoliating the pores and acne itself. And it also has some anti-aging benefits for maybe those that are looking for prejuvenation in their 20s, as well as rejuvenation in their 30s and 40s. So it hits both of those benefits. And you can see here in the chart at the bottom, our prepare, protect, and repair. And so we have products that fulfill those categories, cleansers and an oily skin solution containing these ingredients, as well as some other alpha hydroxy acids, and we'll go through some of those benefits and why we should add those to products as well. Our sheer hydration day product with SPF has the 8% neoglucosamine, so the data we just saw on 8% neoglucosamine and the benefits to acne has that level of ingredient in that product. And then our oil control gel and gel plus, including AHAs, and specifically our oil control gel, we saw the nice benefits in an 18% reduction after just one application of that product. So that is just a little bit on our refined segment. We'll move into glycolic acid next. So again, this is an AHA. It's the smallest AHA found naturally in sugarcane. It does have this highly effective exfoliation, and so again, the benefits of that to acne-prone skin, as well as anti-aging benefits, and of course, pigmentation benefits to decrease melanin clumping, and help with post-inflammatory hyperpigmentation, as I mentioned when we introduced these molecules. So why use glycolic acid in acne-prone skin? So we know it has these really effective exfoliation and cell turnover. So similar to mandelic in that way, it exfoliates to unclog the pores, and also has these pigment evening effects. So it exfoliates to even out pigmentation, while it also is reducing, again, that melanin clumping. So it promotes an even tone with increased clarity and reduced dark spots. And then it has these other skin health benefits, right, to increasing gags and collagen in the skin, and plumping and firming. Where we have this nicely highlighted is in our NeoStrata Pro system. So these are a complete superficial peeling system that contains 6 options for professionals, designed ideally to treat your patients, and will demonstrate some really nice and actually a lot of before and after photos as they benefit acne. And so again, these are not for home use. These are professional products applied under supervision of a professional. And so we have our rejuvenating peels. These are the first 4 shown here, and these contain glycolic acid from 20 to 70%. And then we also have 2 targeted peels, our brightening peel, and then specifically our clarifying peel to target acne and oily skin, which contains, of course, the mandelic acid that we talked about, as well as citric acid at 30%. This is a nice chart of the benefits that you can expect and expectations following a peel series of either AHA peels or retinol peels, and we'll talk about the retinol ingredient as it relates to acne next. But often AHA peels are targeted towards anti-aging, and so there are benefits listed here, but this is a chart that we list in all of our peel inserts to show the expectations and the benefits that you can associate with peels. And so highlighted here are 3 of them as they relate to acne that are pretty significant. So a visual softening of acne scars. So we often talk about treating the condition of acne, but what's left for some people when acne actually starts to lessen are these acne scars. And so peels are a nice way to visually soften the effects, and really that's where the building of this matrix comes in to benefit and smooth out those that texture left from acne scars. Of course, pore size is diminished in appearance, which is a nice benefit additional to an acne benefit with peels. And then, of course, the reduced appearance of the pimples or spots themselves. So we'll go through a number of before and after photos. I always do enjoy presenting acne in before and after photos because it's very obvious that it's there, and then the improvement after is very nice. So this is after 12 weeks for this subject. This is improving acne with some scarring in a dermatologist use study. So this is a 24-year-old female, and she received 5 peels, a 35%, 3 50% peels and 2 70% peels. And we're showing her benefit here after just 5 of those peels. And so you can obviously see that acne she's afflicted with in her cheeks, and the benefits after just a few treatments. And we do have physician impression for this with marked improvement of acne and post-inflammatory hyperpigmentation with peels. The face was virtually cleared and the patient was happy with these results. Another example of teen acne and the benefits to that, as well as benefits to pigmentation. And so there were 3 20% peels administered here and one 35% glycolic acid peel. And then using in conjunction this 8% neoglucosamine product, as well as a glycolic solution in the evening for this subject. Again, some more benefits to acne, post-inflammatory hyperpigmentation, and scarring. This is a really nice result after a few peels. This patient actually specifically had the clarifying peel, which again is that targeted mandelic acid containing peel, along with the glycolic peels layered on top. And so a really nice result here. And again, another one with the clarifying peel layered with the rejuvenating peels. And after 3 peels here, again, benefits to acne, PIH, and acne scarring. This is a case of more adult hormonal acne and benefits to pigmentation and a little bit of the benefits even using these high acid concentrations to that pink tone or erythema that she has. And so you can see the benefits after 3 peels here with home care. This is a nice one for acne and post-inflammatory hyperpigmentation. So you can see those before on the forehead and the cheek area, and then after a really nice result of clear skin. This is after 6 glycolic acid peels. And I think what's more notable here even is throughout the course of the series of these peels, they were able to discontinue their oral antibiotic after the 4th peel, and then a topical prescription cream after their 6th peel. And so these are results, where they started on a couple of medications and were able to, through the series of peel, remove those therapies and still see this clearing of the skin. So really speaking to the benefits of AHAs in this acne and post-inflammatory hyperpigmentation. This is another example. Again, so after 2 peels here, receiving, you can see the benefits to, clearing the skin, no further acne breakouts, and then really addressing this post-inflammatory hyperpigmentation. And so those are some nice examples of how it relates to our Pro System peels and glycolic acid and mandelic acid, but we do also have a home care segment. So those are professionally administered peels. These are home care products that the patient or client could take home and use in between the series of peels. And our resurface segment really concentrates on normal to combination skin types with occasional breakouts. So we have, again, our Prepare, Protect, and Repair, so a cleanser in our Prepare. And these are high-strength AHA products. We have starter and step-up AHAs, again, to improve texture and clarity. We saw the benefits to pore size and, again, exfoliation to clear out the pores. So the wash has 20% AHA in it, and then we do have a day cream with SPF with a high level of 10% AHA, and then our repair or nighttime use products with, again, 10% AHAs. And also we have a smooth surface daily peel, which is nice. It is an at-home peel that can be used as adjunctive therapy to professional peels where they're offered, or just as a nice addition to a skincare regimen where you can use this daily at-home peel for the benefits of AHAs to this normal and combination skin types. I included this frequently asked question because I think it's important. We do get asked, do AHAs cause acne? And so to answer that, there is an increased exfoliation with AHAs from within the pores. And so you can imagine, you know, all of this material inside the pores in this acne-prone population. And so it starts to exfoliate and clear those out. And so you can see AHAs will sometimes bring forth acne that's already present in the skin. And so, you know, maybe an initial breakout people will experience when they start AHAs. And we do often get questions, I started using this and my skin is breaking out more. There is a period where it will be clearing out these pores, and then as those are cleared out, it keeps them clear, and then it mitigates the acne that way. So it does not cause acne, but you can see sometimes this little blip in acne to start, where it appears like it's getting worse before it gets better. But you know, if you bear with it just a couple of weeks, it does get better. And then those benefits continue. So I think that that's just important to bring up, you know, as you're recommending some of these ingredients for your patients. So I did mention retinol. I'm just going to go through one area that we have to address acne with retinol, and this is our retinol peel. I think that retinol is very well known in its benefits to acne. It's part of one of the retinoids family, and so certainly there are prescription retinoids that are used for treating acne. But this, again, is a professional peel, so administered by a professional. It's physician strength, and this contains 3% retinol. So typically in a home care product, you might see from 0.1 to 0.3% retinol, but this is a full 3.0% retinol in a professional peel. And so again, retinol is a proven ingredient. It's very high strength in this to deliver compelling results, and does have some bisabolol in order to help calm the skin. As we know, there can be some irritation from retinol itself. When we were formulating and designing this product with this high strength retinol, we did embark on a study with a key opinion leader here in the United States, Dr. Sadik, out of New York City. And we did publish the full results of this in the Journal of Drugs and Dermatology at the end of last year. This is a newer product to us. And I'm not going to go through all the details. We did look at benefits to facial photo damage as well as acne. And then we did have a subgroup where we saw benefits to melasma or hyperpigmentation, darker skin types, Fitzpatrick 4 to 6, to show compatibility of the peel in those skin types as well. But I'm going to talk about the acne portion of this. So we did have a dermatologist administer this retinol peel every 6 weeks. The acne patients here received 4 peels, and we did have the dermatologist grade overall acne severity, as well as doing some digital photography. And of course, there was home care, our gentle polyhydroxy acids that we'll talk about next as adjunctive therapy, was used in combination with these peels for home use. So this is the acne subgroup, again, dermatologist grading for overall acne severity. So you can see here, starting at mean scores really of marked acne, so in marked to severe acne, and going down towards mild acne after just 4 peels. So a nice result in these few subjects that we included for acne. And this is a nice example using this 3% retinol peel of the benefits after just 2 peels. So you can see obviously before the acne breakout and condition, and then after the benefits to acne, as well as skin texture smoother and diminished pigmentation. And I did include the photo damage group here. So while it's not looking at acne specifically, and it's grading, the dermatologist grading of photo damage throughout the course of 4 retinol peels, it does speak to the benefits to, you can see in the gray line here, mottled pigmentation, and then this lighter orange line for benefits to pore size, and then benefits to clarity and radiance, all really relevant also to acne-prone skin. So this retinol peel is unique, and high strength containing retinol was well tolerated under physician direction in acne. It's applied and then left on for 8 hours or overnight. So that's a little bit different than some of our other peels or peels you might be used to. We did see an improvement to overall acne severity through the dermatologist grading in that subset of patients, and had some good benefits and good tolerability of the home care as well. And so retinol peel, as we know, retinol is a great benefit ingredient to acne. And in this high strength peel was found to be safe and effective to deliver improvements in this acne prone population. So getting a little bit into now polyhydroxy acids. So if you remember, we talked through kind of our generations of AHAs. So we started with alpha hydroxy acids. The second generation are these polyhydroxy acids. And so you can combine, and you've seen some of this already in this presentation, AHAs and PHAs with acne therapy drugs. And so things like combination treatment with topical antibiotics or retinoids, salicylic acid, or benzoyl peroxide. We know the AHAs and PHAs exfoliate and N-acetylglucosamine as well, and they condition the skin. They provide for deep cleansing. And the polyhydroxy acids, as you saw with the retinol peel, are well tolerated, even with use with retinoids. And so we did do a study to see, are PHAs compatible with retinoic acid? And so, you know, retinoic acid, of course, can be known to cause some irritation, and can be difficult to combine with things like AHAs because the retinoid does make the skin sometimes more sensitive to those types of ingredients. But for gluconolactone, we found it is a very gentle ingredient. And so some of the concepts around gluconolactone and using it in conjunction with some of these prescription or high strength retinols is in comparison to AHAs alone. We know that these polyhydroxy acids and gluconolactone is less irritating. They're more moisturizing, and they also provide an enhanced skin barrier effect. In concept, they may improve the tolerability of other potentially irritating topical agents. And we've seen that in a few studies that we and others have conducted. And they may also provide additional benefits when combined with other agents and topical formulations. So you could imagine that it may, it could complement and may even enhance the therapeutic effect of these types of other topical agents, or even just enhance the tolerability of those. And so a benefit either way in thinking about it. So we did use a PHA regimen in combination with topical retinoic acid. So here you see a 0.1% retinoic acid gel applied in the evening. And then we did do a regimen of a cleanser, a day cream, and a night cream up to 15% gluconolactone used in conjunction with this. We looked at total acne lesion counts, and so of course you would expect them to go down using retinoic acid, and that's what we saw, significant improvements after 2 weeks and 4 weeks. Just noting that the use of the PHA regimen did not adversely affect the efficacy of the retinoic acid in treating acne. But we did see that it was very well tolerated. So the PHA regimen, even in this high strength 15%, PHA was well tolerated on adult facial acne when combined with the 0.1% retinoic acid gel. The PHAs were used twice a day, and we saw very little objective or subjective, almost none, irritation when using these PHAs. And so we asked for self-assessment as well. We always want to know that the patient or client is observing the same thing that we are. And so they saw improvements, of course, in their degree of acne and their amount of oiliness using the retinoic acid in combination with the PHA regimen. So showing support of the combination in adult acne. This is another study that's published. Another group did this, comparing gluconolactone to benzoyl peroxide in the treatment of acne. They looked at mild to moderate acne, and so they used a 5% benzoyl peroxide lotion in 50 subjects. They used a 14% aqueous solution of gluconolactone in 50 subjects and compared that to a vehicle in the remaining subjects. Looked over 12 weeks and did lesion counting with a physician. And so just briefly, the results of this is specifically looking at inflamed lesions. They saw significant reductions in inflamed lesions for gluconolactone at endpoint and for benzoyl peroxide. I mean, you'd expect benzoyl peroxide to have a benefit here, but the 14% gluconolactone alone had significant reductions in inflamed lesions at the end. As well as equivalent benzoyl peroxide to gluconolactone in these early weeks. And then, of course, as we saw with neoglucosamine compared to benzoyl peroxide, the benzoyl peroxide does catch up or even start outperforming these other cosmetic ingredients in the longer term. The non-inflamed lesions, so again, reductions observed at each visit. They were significantly reduced for benzoyl peroxide at endpoint, but there were no significant differences between the benefits of benzoyl peroxide and gluconolactone throughout the study for these non-inflamed lesions. And then where gluconolactone really starts to shine is in the irritation component again. So PHAs are non-irritating and have a lot of additional benefits to the skin. But 50% of the benzoyl peroxide treatment group reported unwanted effects compared to only 24% of the gluconolactone group. And so we also saw that benzoyl peroxide was significantly more drying than gluconolactone and the vehicle. So just a nice summary that while they both significantly improved acne, we saw that gluconolactone equivalently to benzoyl peroxide in the beginning 2 to 4 weeks. We also saw fewer side effects observed with gluconolactone, so benefits to other benefits to skin, and of course, not as irritating. And then in our Restore segment, so this is our final segment that we'll review here. This is really adjunctive therapy that can be used or for targeting more adult acne. So powerful PHAs without irritation. Again, we have our Prepare, Protect, and Repair. So we have our facial cleanser, a day cream with SPF 23, and then 15% PHA containing products. And so again, we saw the study with 14% gluconolactone, and these products have 15% gluconolactone, so comparable ingredient strength for benefits to acne, and then of course other benefits in the skin too. So this is my last slide. I just kind of wanted to pull it all together. Really a lot of information heard today of the benefits of AHAs, PHAs, and N-acetylglucosamine, or neoglucosamine as we call it in our product line, for the acne and oily prone skin. And so the exfoliation and normalization of the keratinization process to help unclog pores and smooth skin texture. And it helped to reduce pigmentation irregularities, particularly in PIH. So we saw a lot of examples with that for mandelic acid and N-acetylglucosamine, and really all the ingredients that we talked about today. Specifically, we saw with mandelic acid the ability to reduce lipid production and show less shine and surface oiliness. We had early benefits to acne-prone skin. So with PHAs and neoglucosamine, we saw that they can be used in conjunction with topical therapies. We saw their early benefits to acne-prone skin, and their benefits to less irritating alternative to benzoyl peroxide or other ingredients. We saw some benefits and talked about PHAs as non-irritating adjunctive therapy, so using it in combination with retinoic acid or other ingredients. We've used it with azelaic acid as well and seen benefits there. High strength professional AHA and retinol peels, so another way to be able to approach this condition through a professional setting. And so we know the benefits to acne, but there's additional benefits specifically to texture and acne scarring using these high strength peels. And then there are a number of other benefits we touched on a little bit. We're really focusing on acne here, but of course, a lot of these ingredients also have antioxidant and anti-inflammatory properties. They improve skin barrier and have a lot of other dermal matrix building and benefits to, the signs of aging that, we didn't go through today, but, as they relate to acne in the older ages, people may be looking for both benefits. And then, of course, we went through the different skin types and how the segments address those needs, and how there really is a product or an ingredient here suitable for all skin types. So that wraps up, our acne discussion and some of the NeoStrata ingredients that can specifically target oily and acne-prone skin. And so I thank you for your time today, and I'm happy to answer any questions.
Well, I thank you so much there, Brenda. So good to hear all of that information there. There is so much to take in, so valuable. We have lots and lots of questions coming through, but in the short term, while you gather your breath, have a little drink, what I'd like to do is be able to just say hello to a few people, and we can look at these questions coming through as well as we're going with it, because we've got lots to get through. So Marcel, Kirsty, Bronwyn, Juliet, Kathy, Emily, Nicola, Sandra, Kezia, Kerry. There are so many of you. Hello, everybody. We can't thank you enough for joining us today. Daly, Inma, Yvonne, so many people, so many regular people who we know are great fans here. Chelsea, thank you for joining us. Jenna, Natasha, Shafia, Lucy. I cannot go through this list, otherwise we're going to be here forever just looking and name-checking people.
Great,
but
so
I do like to give value to that. But I'm going to go back to the very first question that came in, because I don't want to miss this. Kerry always comes in early doors. Kerry is a big fan of NeoStrata, Brenda. So I just wanted to make sure I asked this straight away. So Kerry is asking, for patients who experience acne in the chin area, are they reporting more concerns, increased acne lesions, if they are needing to wear face masks? So we know this is the new normal. Face masks for traveling, their jobs. So, are we seeing an increase in this? And the results you've discussed today, do you think there'll be of value to help those conditions?
Yeah, it's a great question. And, so a lot of these things are just emerging now, right? As we're all required, in various areas to wear face masks and really start occluding the skin. I think there's a couple components to it. I think that masks can be irritating for sure, particularly when you start wearing them regularly. Your skin is not used to it. And we see that irritation from a lot of physicians. Showing how they're using things, and, face masks and then different products to address that. I don't know specifically if it does cause more acne. I can imagine that there would be a component that could cause more acne breakouts in those prone to it. So I do imagine that could be a result of wearing face masks. And I think, the ingredients that we talked through today, particularly in the context of face masks, the PHAs as adjunctive therapy, they build skin barrier. They're really going to make your skin more hardy and resistant to all of that rubbing and irritation associated with wearing face masks. And they're gentle, so they're hydrating, and they're going to help to really provide benefits of all of these negatives of wearing a face mask. And you know, we know it has the benefits to acne prone skin and clearing the pores. So I think those would be a great solve for those individuals, you know, as they're wearing face masks.
Yeah, I completely concur with that, and you know, we recently put a kit together where it really was focused on those bionics as well for that reason. So it fits beautifully. Yeah. It really does. It really does. We have also got our lovely people from North Dean asking, with an adult patient over 40 years, so coming into those mature years, is it possible to use the AHA peels and alternate with retinol peel to address the hyperpigmentation / acne conditions?
Yeah, I mean, the nice part of our peeling system is the flexibility we have in it, right? So we have the targeted boosters for brightening, for clarifying or acne prone skin. We have all of the strengths of the glycolics and the benefits that those bring. And we have the retinol peel. So yes, you know, we do have recommendations around how frequently to use each of those, and it's always based on skin tolerability. So you do want to make sure that the skin's completely healed in between peels. But yes, you can alternate them in your office as different ways of getting benefits. You know, there isn't really one ingredient that's going to address all issues. And so the benefit is to use these different peels, whether it's glycolic, whether it's mandelic, whether it's citric, or retinol, and provide those benefits to your clients and your patients.
Perfect. Yeah, the versatility of it all is there to be used.
Yeah.
Inma, I'll just very quickly answer in regards to retinol peel. Retinol peel is a physician treatment only, as with the higher strength of the AHA peels. So I will answer that one quickly for you there. If you're a UK customer, reach out to us and we can discuss this with you for future alternatives. We are then looking at so patients who are claiming perhaps with the retinol peel they don't see much difference with the skin, they don't notice much of the skin peeling. Well, I mean, Brenda, this is patient to patient, would it not be?
Yeah, so yes, so you know, as we know, skin types are extremely variable, and humans respond to everything with a high level of variability. These are superficial peels, right? All of our peels are superficial peels. And so while you see the benefits to radiance and those kinds of things with our AHA peels immediately, and of course all of the deeper benefits for the skin through a series of peels, there is not typically any visual cue with our AHA peels. Our retinol peels, sometimes people will get like a light peeling effect. And I didn't show it today, but we do have some before and after photos on that initial peeling. That usually happens within a few days after the peel and lasts about a week. But again, it's variable. Some people will see it and they will kind of shed that top dead layer of skin. And other people, it's really a kind of a micro peeling that they don't really notice. But the benefits are there. You've applied those high strength peels, and you know, all of the other benefits are happening, and you'll see the benefits whether you see the actual peeling or not.
Absolutely, yeah. I mean, micro peeling is a good way of considering it, because it's again everything we do at NeoStrata really is a non-aggressive approach. Therefore, you don't necessarily get the downtime, and that is the good point about it.
Right.
So hopefully that's helped us understand there as far as that goes with the retinol. And further to that, Daly has asked, great webinar so far, they've put, which is lovely. Thank you for the feedback. Yeah. And we're being asked, is the retinol peel self-neutralizing? Which I'll let you answer, and then I'll come back to the question on what a therapist could use as an alternative.
Okay. So it is a great question, and I think it's great, particularly as we are all really well versed in AHA peels, and we know that you do need to neutralize the high strength AHA peels, right? So we have this new retinol peel. Why do we leave it on the skin, and why do we not need to neutralize it? So retinol is at a higher pH. And so it's not really it's not the retinoic acid, it is retinol. And so there's really no need to neutralize it at that point. And if you're familiar with it, you know that you apply it to the skin and you leave it on up to 8 hours or even overnight. And so, yes, it absorbs into the skin, it does its job. And then at some point through those many hours, you know, everything that was able to get into the skin and have its benefits has worked itself through. And then, you know, there really is no need to neutralize it.
Precisely, and I'm going to come back to, there's quite a number of people asking about therapists, so I am going to address it again, but just in respect to the no need to neutralize, Eleanor had asked, before starting the retinol peel journey, does the patient need to prepare the skin to acclimatize the skin?
Yeah. So that is a good question. We do have our resurface line, and so while it has AHAs, and we do recommend that before our AHA peels, of course, that also can be used before the retinol peels, which is nice because it does do that exfoliation and prepare the skin for the peels. We do often, it is a good idea to have had someone exposed to retinol before you're giving them these high strength retinols. So, you know, a low level cosmetic kind of retinol exposure would be prudent before going to the higher strength. So, you know, we do talk around that a little bit. You know, and there is, again, it's a little bit patient specific. So, you know, you have to kind of balance tolerability of the AHAs or the a retinol that you're using beforehand. You don't want the skin to be irritated and then peel it. You know, your skin has to be intact and not have any irritation before you do the peels, or you're really going to see a lot of irritation and discomfort for the patient. So it's a little bit of a balancing act. And, you know, it is always a good idea to see a lower level of an ingredient before you put these higher levels on.
Yes, I mean, it's a caution of common sense, really, to be sure that it's there. But in reference to potentially, is it necessary in the same way as we might prepare the skin for the AHA peels? Then no, it's not requisite. It's just perhaps wise. But then in the same vein, Sandra has asked, how long should a patient stop actives following a retinol peel? So how long should they avoid the active acids and topical retinoids once they've had their retinol peel from NeoStrata?
Yeah, so we usually say you really want the skin to return to its normal state before you start your normal regimen, right? So meaning people react differently to the peels, and then particularly if you're doing AHAs and building your way up to the stronger peels. And so you do want to leave a little bit of time afterwards where you can use our restorative products, PHAs and bionic acids, help condition the skin and provide that extra hydration and help kind of the healing process. So we're doing these micro peels. We're not getting into like heavy healing, but you did just peel the skin. People may feel a little more sensitive. Sometimes it's a day. Sometimes it's a few days. Sometimes with the retinol peel, it could be a few days. It could be up to a week that they see peeling. And so they may want to alter their routine based on what they're feeling and seeing. And then when they feel like their skin has returned back to normal, they can go right back to their cosmetic actives.
Most again, it's once that shedding has taken place, then we know that the action has happened. But to use the Restore range, those polyhydroxy gluconolactone based ingredients is going to be your best bet afterwards as well. Which is also where I think Sandra has asked us if we've got any plans for NeoStrata peel training coming up in the near future. I'm sure it's on everybody's minds right now. When it comes to hands-on peel training, just bear with us. Once we know what we can and can't do, when the new normal is fully with us, then look out for those dates and what we're able to deliver to you. But there's going to be a lot more online training as far as understanding any of this technical information, product information. So there's going to be a lot more coming your way, everybody. But just bear with us as far as hands-on peel training is concerned. But reach out to us directly as Aesthetic Source, because once we are able to move around more freely, we will be able to start looking at that again. So let us know what your interest is, which means we can put you on any waiting list and prioritize you when anything comes up. So coming back to, if you don't mind, Brenda, I'm just going to mention where people have asked, can a therapist use the retinol peel? So this is a physician, doctor-based peel for them to use and apply. But coming soon, I'm just going to drop a little tiny teaser in here for everybody, because coming our way real soon, later in the year, we are going to have an Exuviance Professional variation of this for all of us therapists and estheticians. So look out for that, everybody. There's going to be something for us all to have as an alternative, but it is still based on that NeoStrata technology. It's still coming out of that same research and development with that proved clinical evidence. So that's really exciting. So I've been given permission to tease that from my marketing manager in the background. So thank you, Vicky, for letting me do that while we've been talking, which is amazing. So that is wonderful. Now, we've just got one more in regards to, Kerry was asking in regards to mandelic acid and nut allergies. Sort of, sorry, that I was going to say in a nutshell, that's a really, really bad turn of phrase under that. Now, we all understand that our ingredients are synthetic derivatives, but I thought I will pose the question of, do we have to worry about almond or nut allergies with mandelic acid?
So, as we stated, mandelic acid is derived from almonds. It's found naturally in almonds. However, as you said, Nikki, we do use the synthetic versions. And so the real problem with nut allergies typically is a response to the protein. And so these synthetic ones do minimize that risk. They're different than eating or being exposed to the natural ingredient. You can, always test a small area on someone before you would do a whole application if it's something that you're concerned about or the patient is concerned about. Or, there are other AHAs if they are really hyper concerned. You can always steer them towards our other AHAs that are not derived from nuts, but really, like, it's the synthetic version is okay.
So good. But you know, always check with get your doctor's understanding and permission is always a good thing if you are truly concerned, I would say, on the back of that one, which is great. Thank you. I know Vicky's answering a couple of other little questions in the background, which are not technical, as from we don't need to be asking you, Brenda. So thank you, Vicky. Anybody who's asking for information, yes, of course, we'll be sharing information with you. Reach out to us. We can pass you on to the relevant people that might be required. If you're international, we will pass you back to the relevant persons who are required to do that. And we've got lots of thank yous coming in, Brenda. Lots of people really enjoying what they've seen. Marianne, Jess, Kerry, thank you. Amy, we really appreciate. Jackie, thank you too as well. Julie, can you use NeoStrata peels if your training is with exuviance? We would need to be certain of qualifications, and there'll be certain levels, and indeed there would be certain product knowledge advancements that we would need to do with you. So reach out to us and we can help you go through the conversion that's required if it's relevant. So we will support you in that wherever we can. Due to the difference in the strength and the difference in the pH, it really does depend on where you sit with your qualifications. Genevieve, thank you, really enjoyed it. Oh, how wonderful. Always learn so much and install my love for NeoStrata with a big heart. I mean, these things are just, it makes our day, sets you up for your morning, I guess, from that point of view. And then just one more quick question from Julie. Good question, actually. Would retinol peel be good for clients in their 70s? So for people who've come out the other side, so 70 years of age, would a retinol peel be suitable and good for that patient?
Sure. So, I mean, the benefits of retinol at that point to anti-aging, assuming we would really be your target, right? So you're not looking at acne-prone skin really when you're in your 70s. But yes, all of the benefits that we know of retinol to anti-aging would be great for someone in their 70s.
Yeah, I mean, why not? I love the fact that you've got patients coming to you at that age and clients wanting to look after their skin. And I would certainly say all of the adjunctive home care that we've been talking about as well, which will actually just keep that skin working, keep all of that, the layers turning over. It will give that skin fitness, as we call it, to really ensure that they're going to get all the support they can. So, I mean, I think at that point, thank you once more. You know, this is quite incredible. And Brenda, we've actually got, and for everybody who's on the call, I'm sure most of you are aware of the wonderful Anna Baker, who's our clinical lead and trainer. Anna actually has an Instagram live at 4 p.m. on Friday, and she's actually going to be on that Insta live at Anna Baker Aesthetics, discussing the Refine with a client and the results and everything that's happened, actually using the Refine range. So that actually fits really, really well. So everybody, if you've got chance, Friday afternoon, 4 p.m. So that's tomorrow. What am I talking? It's tomorrow with Anna Baker. So that should be really, really fun. At Anna Baker Aesthetics on Insta Live with a real life patient, seeing those results taking place. And I'm sure we could join that, you know, maybe those of us who are working with a glass of wine, if that's what you fancy, or maybe a sneaky one if it's near the end of our day. But in the meantime, do you know, thank you once more. It was good morning for yourself, Brenda. We cannot thank you enough for your time. It's very precious, and we can't thank you enough. Also, Kathy, I want to say a thank you to you. I know you're there in the background as well. But more so, can I say a huge thank you to everybody who joined us on the call today. Reach out to us. We're here. We can answer those further questions. and bring to you anything we might want to. Next Wednesday, we actually have got an introduction to exuviance professionals, so anybody who feels interested in that range that we've mentioned and teased you with, do join us for that as well. So without further ado, it's good morning to you, Brenda, and good afternoon to everybody else on the call. Thank you.
Yeah, really my pleasure. Thanks for having me.